In the last class, we were discussing about the classification of drugs. In the classification of drugs, we have seen drugs acting on the central nervous system. In the class drugs acting on the central nervous system, it has been subdivided into few more groups. In that, we have seen non-selective CNS depressants. Today, we will discuss about selective modifiers of central nervous system. In this, the drugs treated for convulsion, that we call it as anticonvulsants, barbiturates and hydantoins, and antitussives acting on the cough center in the brain, psychotherapeutic agents. Next class is the central intraneural blocking agents. Next, we will move on to the central nervous system stimulants. Normally, when a person is in the depressed mood, stimulants are given to elevate their mood. In this class, we have the medicines like analeptics, psychomotor stimulants and antidepressant drugs. When a person is in very depressed mood, psychomotor stimulants are given and antidepressant drugs are given to bring them to the normal mood. Next, we will move on to the drug stimulating or blocking peripheral nervous system. Cholinergic and anticholinergic agents, adrenergic stimulants, adrenergic blocking agents and inhibitors of catecholamine biosynthesis and metabolism. Histamines and antihistamine agents. Antihistamine agents are normally taken when the person is suffering from allergy. We have running nose problems and all that. In that case, antihistamine drugs are given. Next, local anesthesia. Local anesthetics are applied to inhibit the pain locally. If small operations are being done on body parts, local anesthetics are given. Next class, in these are drugs acting on the cardiovascular, hemopoietic and renal system. Glycosides, antihypertensive and hypotensive drugs, antiarrhythmic agents and vasopressor drugs. The people suffering from cardiac problems, maybe it is high BP, low BP, these drugs are given. Next is drugs acting on the blood. We call it as hemopoietic agents, anti-anemics, coagulants, anticoagulants and plasma expanders are coming under this class. Next is in this class is diuretics, drugs acting on the renal system. Next class of drugs is chemotherapeutic drugs. These chemotherapeutic drugs are given for infectious diseases. These infectious diseases are of different type depending upon the pathogen, whether it is a virus, bacteria or fungi. So, in this class there are many drugs coming under organometallic compounds, anthelmintic agent. Anthelmintic agents is given for the worms and anti-malarial agents, anti-protozoal agent, antiseptic, antifungal and antibacterial agents. Sulfonamides also coming under chemotherapeutic drugs. Next, antitubercular, anti-leprosal agents, antibiotics, anti-neoplastic and antiviral agents. Anti-neoplastic agents are given for the patients suffering from cancer. Next class of the drug is vitamins. We learn a lot about the balanced diet in our daily life. Balanced diet contains appropriate amount of carbohydrates, proteins and vitamins. Vitamins comes under vitamins and minerals. We say that vitamins and minerals also required to our body. So, many people think that vitamins is a food supplement, but it is food supplement as well as a medicine to our body. The deficiency of these vitamins will cause some diseases. In the class vitamins, there are two types of vitamins, water soluble vitamins and water insoluble vitamins. Vitamin B and vitamin C come under water soluble vitamins, whereas vitamins A, D, E, K come under fat soluble vitamins. Fat soluble vitamins means they are soluble in lipids. Vitamin B, when we talk about vitamin B, it is vitamin B complex. It includes vitamin B1, B2, B3, B4, B5, B6 and B12. These are present in fruits, vegetables and some products from animals also. Vitamin C, we call it as ascorbic acid it is present in citrus foods. Vitamin A. Vitamin A, we all know that beta carotene is a good source for vitamin A, and vitamin D, we say that sunlight is the source for vitamin C. Actually, in sunlight the vitamin D is not present. The cholesterol present in our body under the irradiation of UV light getting converted into vitamin D in our body. Sunlight in the morning and in the evening is good for health to convert the cholesterol present in our body to vitamin D. Next, moving on to the hormones. Hormones, they are required in small quantity and specific in their functions. They are involved in lot of metabolic processes in our body. The deficiency disease can be cured by giving that particular hormone. These hormones are synthesized in our body by different glands like thyroid gland, pituitary gland, pancreas, like that. Any problem in these glands which secrete these hormones will cause deficiency of the particular hormone, which will hamper the metabolic process. So, whenever the people suffering from hormonal imbalance, that particular hormone is given to the patient to cure that diseases. So, thyroid and anti-thyroid drugs, we know that people suffer from hypothyroidism and hyperthyroidism. So, in order to cure that disease, particularly the thyroid hormone has to be given to the patient. Pituitary and hypothalamic hormones, pancreatic and hypoglycemic agents. So, the people may suffer from diabetes and all that. Then sex hormones, the people suffer from a lot of diseases due to the deficiency of these hormones. So, that has to be treated by giving that particular hormone as a medicine. Okay. So, these are all about the different types of drugs coming under different classes based on their therapeutic action. Thank you.